There can be some sort of vivid visual experiences even with the eyes closed, a sense of awe, and then often positive mood also as part of the experience, something sort of a beautiful, elevated, almost noetic quality. I'm Dr. David Erritzoe. I'm clinical director in the Center for Psychedelic Research at Imperial College, and I'm rethinking the way we treat mental health conditions by testing psychedelic assisted therapies. Psychedelics are really interesting compounds. A lot of them come from nature. A lot of them have been used for a long, long time. So it's not completely novel that we and colleagues around the world are now studying psychedelics. It's leaning on the shoulders of work that was done in the 50s, 60s, which was the first era in the Western world of testing of psychedelics. But the whole thing was closed down because laws that made it impossible to conduct research with these compounds happened around 1970. So then it was lying dormant for decades until it was reopened more recently. The talking therapies are being sophisticated, new models are coming, and that actually means that the psychedelic therapies are more ready to be sort of welcomed into therapy, into the mental health space than they probably were in the 50s, 60s, because you need the talking therapy model onto the psychedelic drug administration for it to really work. So it's a combination of psychotherapy and pharmacological intervention with these compounds. So we have done the first trials in this modern era. We have treated people suffering depression to quite a significant degree, and then now we are doing anorexia nervosa, and we are very soon starting an OCD study and a chronic pain study. It's not that there necessarily is something wrong with the current treatments, but they're limited. Most of what has been introduced for depression, anxiety, eating disorder, post-traumatic stress, and a range of conditions in mental health, they have just been reformulations over the same recipe with minor modifications of these compounds, and up to more than a third of people do not respond at all to the current treatments available, and therefore it's important to rethink and introduce new compounds. The one that have been in primary focus over the last 5 years and really been scaled up is psilocybin, and specifically for depression, both major depression and also resistant or hard to treat depression. And that looks very promising. I mean, some of the things that I think is surprising if you come from conventional psychiatry, conventional treatment models, is this thing that you have in our depression trial, for instance. We saw that the nature and depth and quality of the experience of this psychedelic altered state experience during the treatment session, that's predictive of the outcome. At least there's a correlation. They seem to have long-lasting therapeutic effects. For some people it might be weeks, for a lot of people months, and some people even years. And that is why there is this optimism and this hype in these years about psychedelics. One thing that I think is kind of a beautiful component of psychedelic treatment model is that we have an understanding and an appreciation of the importance of the mindset and also the setting. They are given the drug, typically first part of the day, and then a 4 or 5 hour trip experience wearing a blindfold most of the time, lying in a pleasant environment, dim light, plants around, some nice and supporting decoration, something interesting to look at when they're not wearing the eye mask. So the typical experience, so it can be challenging. So people sometimes can have periods during the trip of anxiety, of some resistance that they need to overcome, and that's also part of the preparation work. The very recurrent theme was that avoidance turns to acceptance and a sense of disconnect turns into a quite profound sense of connectedness. So all these are classic features of psychedelic experiences. And then afterwards, we integrate together with the person, that the therapist will then sort of speak through the experience, and that's done through some sessions in the time after the psychedelic sessions. More and more compounds are being tested these years, and the hope is that they will be available for people who are suffering, even in public health systems. So it's not going to be just expensive private clinic work, but actually be really available for the people who really need it and who might not be able to afford it. All that is being studied and investigated, and we will do more studies, but we have to then take a step back and to do the first work. How do they work in the brain? What are the right doses? How do they affect people who are not depressed? Is it safe then to give them to depressed? All that work is being done here and other places. The regulatory bodies such as, so these agencies like the FDA in America and MHRA in the UK and EMA in Europe, continental Europe, those agencies are actually quite progressive here. They do understand that this potentially could mean a lot for a lot of millions of people. But before it should be available, we need to see the end of these phase 3 trials, that it really does work well enough and it is safe enough. Before that, it would be wrong for me as a medic to sit and say, I want these treatments out. I want to see the results first. But so far, and we have a lot of results already, they are very promising.